Hi, my name is Marcus Warnes and I'm the Accountable Officer for the 6 Clinical Commissioninig Groups in Staffordshire and Stoke-on-Trent. The CCGs are clinically led by local GPs, and together with staff and lay members, we're dedicated to improving the health and care services you receive. We design and buy services for a population of 1.16 million with a budget of around 1.8 billion, which works out around about £1,580 per person. We work in partnership with NHS service providers and hospitals, local authorities, voluntary groups, and some non-NHS healthcare providers. And at the heart of everything we do are you, our patients. To enable us to deliver a local service, we've been working across 3 key localities: the north, southwest and southeast of Staffordshire and Stoke-on-Trent. The coronavirus has seen a dramatic shift in the way the NHS has needed to function that's probably more profound than anything since its foundation in 1948. And I'm really proud of how everyone across Staffordshire and Stoke-on-Trent's health and care system has adapted to basically a massive crisis at unprecedented pace. Everyone has played their part to meet the new challenges posed upon us, and I want to thank everyone for doing their bit. I think it's fair to say that things will never be the same as they were before the crisis, but there are some innovations that will become a part of what the new normal looks like. In 2019-20, our performance against many of the NHS constitutional standards were good, and we provided a detailed table in our annual summary for more information. Both our mental health providers are performing well, with the mental health access team now available 24/7. We're planning to commission a new service for people experiencing common mental health problems as well. So the downside to some of this is our financial position. We've had to spend more money than we receive to ensure our patients are kept safe, and we're working on how to restore our financial balance. In January, we asked people to help us make difficult decisions about 5 treatment areas that had varying policies across the county and the city. The results of the feedback will be used to help inform future proposals through a consultation so that we can be consistent in the treatment we offer to people wherever they live in Staffordshire and Stoke-on-Trent. A major activity last summer was Together We're Better's engagement exercise, which concentrated on urgent and emergency care, mental health services, integrated community services in the south and the east of the county, maternity services, community hospitals in the south of the county, and planned care services. More than 2,000 patients, staff and members of the public shared their thoughts about what's working well, what needs to be improved, and what is important to them. Meanwhile, important decisions were taken about the future of health services in northern Staffordshire. Now the decision-making business case has been published, we can proceed with developing integrated care hubs, from which integrated care teams will deliver services, moving away from using beds in community hospitals where it's not appropriate to do so. We're convinced it will improve outcomes for patients and help better support our workforce, and act as an important aid to retention and recruitment of staff. The model that's been developed in the north will now be implemented in the rest of the county to enable people to be cared for at home rather than in a hospital bed where it's clinically appropriate to do so. Of course, the various engagement activities we'd planned for 2020 have been put on hold due to coronavirus, but we'll be making sure we continue to involve patients and the public in all of our decisions. So please keep an eye on our social media and websites for updates about these pieces of work and for details of how you can get involved.